This is the poster, Putting the Care Back in Care Plans, Skin Care Bundles by the Department of Nursing for Care Week, May 16th through 20th, 2022 at RHI. The objectives for this poster are to describe the hospital-acquired condition occurring at RHI, understand the application of a bundle to address a clinical issue, and to identify 4 skincare aspects addressed by the skincare bundles. An increase in hospital-acquired pressure injuries was noted via quality benchmarks the first quarter of 2021. A review of cases indicated coding issues, and a process was created to assure accurate reporting by codes to the Uniform Data System, part of the United States Centers for Medicare and Medicaid. There still remain clinical concerns. Literature identified nursing exploration of skincare bundles to decrease the incidence of hospital-acquired pressure injuries. Bundles have proven successful in decreasing catheter-associated urinary tract infections and central line-associated bloodstream infections. We chose to pursue a bundle as our strategy to implement consistent preventative and restorative interventions for skincare and pressure injury. A stakeholder group of the wound care team staff, an educator, a program director, nurse managers, therapy representatives, and the clinical nurse specialists met to review the literature, examples, and adapt bundles to our rehabilitation setting. The wound care specialist identified patients who had both incontinence and mobility issues were at highest risk for skin breakdown. The 4 bundles selected were high-risk bundle associated scores of less than or equal to 18. And these were the interventions selected for that bundle. The second bundle was incontinence moisture. And so these were the interventions via bowel and bladder mechanisms, barrier cream, if the patient had fungal dermatitis. And our wound team specialists had typically identified that any patient that had both incontinence and mobility issues was at an increased risk for skin breakdown. The third bundle was mobility and transfers. The therapist would complete this bundle and post it at the head of the bed based on the interventions they wanted us to see used for mobility. And the final bundle was existing wounds, either pressure related or device related. And then these would be the recommended interventions, either from the wound team, again, that were posted at the bedside. So initially, patients may not have any concerns on admission, but can develop them. And so expectations for staff to also be able to select and post the bundles on admission was piloted on Unit 1. Or we also wanted the staff to be able to post the bundles if the patient's condition changed over their length of stay at RHI. Revisions might also be necessary as the treatment plan is modified. So these were laminated and easily to adjust. A revision in our post on admission documentation form was revised. Also to include a notation of which bundles were selected on admission. Staff nursing initiated pilot on Unit 1, and it met with variable levels of success due to staffing vacancy and additional admission process requirements placed on the RNs. Therapy, as previously stated, agreed to post the mobility transfer bundle. Staff feedback was very positive about these as visual clues and constant reminders of patient skincare expectations. Initiation and revision of the signage continues to vacillate, but we have returned that expectation to the nursing wound team to initiate. The wound care specialist has perceived that this initiative has increased prevention of patient skin breakdown, and we are investigating how to better measure this particular outcome. The posted bedside bundles were basically the skin integrity plan of care to prevent and address skin care injury. Due to the volume of bedside flyers, reminders, whiteboards, and patient family bulletin boards, the team wondered if any decreasing effectiveness would be noted due to sign fatigue. This would be comparable to what is experienced with multiple alarms leading to alarm fatigue. A subgroup of the nursing leadership team brainstormed options and chose to pursue integrating the skincare bundles into our electronic medical record plans of care. Our Cerner nurse super user liaison and the clinical nurse specialist pursued this potential EMR revision, but barriers existed on the EMR vendor side related to differing priorities and timing constraints. So this is yet to be achieved. This is the end of our poster. If you have further questions, please feel free to contact me, Jo Ellen Rust, clinical nurse specialist at RHI. Thank you very much.